and recognize that UnityPoint Health currently, and we're working on expanding it, but currently has 8 million plus patient visits a year. It's
a lot of
8
people.
million people's lives that you can have influence on. Meeting Scott Kaiser and the leadership team at UnityPoint Health, I was convinced that UnityPoint has all of the components to be a transformative healthcare organization. And so I signed up, and so far, so good.
Yeah, so
Yeah.
that's awesome.
Yeah.
So how does it feel going? You had this. It sounds like you have this um, population health mindset of I want to help more people with one solution, or just not one solution, but like it's one thing when you have one on one
Yeah.
with a patient. It's another where you're one on 1,000.
But see, the great part about going from bedside practice to an administrative role is that everything that you do at the bedside should inform where you're taking things from a leadership perspective. Because every patient that I've ever encountered, every physician I've encountered, every advanced practitioner, every nurse that I've encountered has influenced how we take that. Because at the end of the day, I can say, oh yeah, well, we have this fantastic system. We've got to balance the needs of the one and the needs of the many, and understand that for any physician, nurse practitioner, they're only focused on the one. And the
Right.
system has to be able to support what they're doing there. So yeah,
Right.
that's my mindset, but it's a population health mindset with a bedside perspective.
Yeah, no, I love that.
Yeah.
One of the things I found kind of like a fun challenge, but still challenging nonetheless, is when you're thinking about population health, right? Like let's just take a diabetic population, or that, you know what I mean? And you're like, okay, let's do A, but also those people in that group, there's probably thousands. There's probably, let's just take 10 people, all have different issues,
Yeah,
right? So sometimes that one solution may not fit
that's
everybody,
correct.
and you have to try to figure out, okay, how can I fit this piece into this hole that doesn't fit for other patients?
You are completely correct, which means that we can't solve all the problems. What we can do is solve for whatever the macro problem is. So, as an example, one of my biggest responsibilities in UnityPoint is helping to redefine what we call service lines. Service lines are really just a condition. For us, the big ones are cancer and heart care, right? Well, every patient comes in whether they have a heart attack, heart failure, whether they have colon cancer, prostate cancer, everybody's coming in with something different. But what can the system do at a population health to solve for that? Well, okay, go back to what I said, which is what do patients want first? If I'm sick, I need to see somebody.
Yeah.
I need access.
Access.
And when we say the word access, people love to make it this nebulous concept. Our team have really defined it as, no, if you have cancer or you have a heart condition, access is speed to treatment.
Man.
Can you tell me how quickly you're going to help me with my problem?
Yeah.
Speed to treatment.
Yeah.
And then the second is, and then can this not be a miserable experience?
Mm-hmm.
Those are the only two things that as a system I can solve for. And so what do we have to do? Well, there are thousands of things that go on behind the scenes. But from the patient's perspective, it's what have you done to give me my speed to treatment and made sure that forget the complete negative of I don't want this to be a miserable experience. In fact, can this be a great experience where I'm like, you know what? Not only was this not bad, I actually feel better about the team that's treating me and the system that's treating me. And I know we're getting into it for the Black Beds Health panel, but I'm comfortable telling people, no, it's okay to go to the doctor. It's not a bad experience. We need you to go and get seen earlier because, as you and I were talking before, I am a hospital medicine doctor. My entire practice, when people come to me, I say, Dr. Johnson, I want to see you. You never wanted to see me coming because the only time I was going to see you is when you're in the emergency department and I'm about to admit you to the hospital. It's not a place most people want to be.
Right.
I don't want our patients in our health system, in our hospitals, unless you need to be there. I'm so sorry.
Right. Something important's happened on ESPN. We got to know.